Stark State College Massage Therapy Lab Notes with Michael Vahila, licensed acupuncturist and licensed massage therapist. On the massage of the face, I want you to keep in mind, first of all, that this is optional. So some people like having their face massaged, some people don't like having it massaged. I usually do not include it in a general massage unless they ask or there's something going on there. Also, you could do a half an hour on the face, but within this entire routine, even though there are many things you could do on the face or the feet or the arms or whatever, we're trying to be able to cover the entire body in 50 to 60 minutes. In the clinic, you're here for 50 minutes. In real-world practice, you may be working on people for an hour. So if this seems like a very short routine, it's because it is a short routine, because it's in the context of a full-body 50-minute massage. So we start again with passive touch at the side of the head. That's just gently caressing the side of the head, and this is a good time to just take a nice breath and connect with your patient. And then gently bring your hands up and start with digital stroking on the forehead. With stroking, remember to alternate the hands, and this is digital stroking, so the fingertips. And then from there you'll go into friction with the thumbs, medial to lateral. And this is spreading the frontalis muscle. I do 2 strokes just above the eyebrows, and then move superiorly, and then do 2 more strokes there. Again, you're not working if a person has wrinkles on their forehead. There are very specific techniques that can be done for that. That's not what we're trying to achieve right now. From there, you'll go into digital kneading from the temples, doing both sides at the same time, moving down to the chin. Small circular motions, and then you can friction back up and repeat that. So in the temples, many people get temporal headaches. The temporalis muscle, which is where we're working here, gets very tight. Also, people who have temporomandibular joint dysfunction, the muscle I'm treating right now, the masseter, plays into the pain in that joint. But just very generally, doing the digital kneading, and then I was just frictioning back up. Now we're going to do something a little bit specific. The zygomatic arch is here, and you're just going to gently glide. We're not using any lubricant, so this is a very gentle friction stroke through the masseter muscle, first on one side, and you'll want to locate that landmark. That's where the stroke begins. And then again, you can always come back up with friction. And then you go to digital kneading around the ear. So just 1 or 2 fingers going all around the base of the ear. The temporal fascia wraps the ear, and the fascia also can get constricted. And then just gently stretching and unrolling the ear, pulling in all directions. So I usually do a gentle traction downward and outward, and then just out to the side and up. And then from there going into digital kneading of the scalp. People generally find this feels very good, but make sure you use the pads of your fingertips. So you don't want to go in like this, but pads of the fingertips, you can do both sides at the same time. Also, as I'm doing the sides, as you get up closer, you can start to get the thumbs into the sagittal suture. Many books teach to press and separate that sagittal suture. And like with the neck and shoulders, you can always add friction strokes. You can mix and match these in a variety of orders, but in the interest of keeping it brief, if you do that much, it ends with passive touch, which is where then the routine for the neck and shoulders starts. And that's where from there you can go into kneading the neck, digital kneading of the neck, where you make that motion where you push up in and come down. You hyperextend the neck, traction, and then digital kneading of the occiput. So that's an extension of what you did in the scalp. But this is a place where you would be free to, say you're doing this digital kneading of the occiput and you could tell that they really like the scalp kneading, you might extend that up into the scalp again and give them a little bit more of that. So paying attention to what your clients like allows you to give them more of what they like. And then mixing and matching in with any of the techniques that were in the shoulders and the neck. But that's a fairly smooth transition. So it's easy to incorporate transition from face to neck and shoulders, and then applying the lubricant and doing everything else we did in the neck and shoulder routine.